Kun je je voorstellen, je hebt dringend medische hulp nodig, maar niemand komt je helpen. Als Riders for Health er niet was, was dit de dagelijkse realiteit in Gambia. Welkom in Gambia, de Smiling Coast of Afrika. Het kleinste land van het vasteland op Afrika. Het staat bekend om de vriendelijke bevolking en de kleurrijke cultuur. We maken deze documentaire om te laten zien wat voor impact Riders for Health heeft. Hun werk is belangrijk, want ze maken een groot verschil in het redden van mensenlevens in Gambia. Riders for Health speelt een cruciale rol voor de gezondheidszorg in Gambia. Ze onderhouden voertuigen, trainen chauffeurs en zorgen ervoor dat alles goed werkt. Sinds Riders for Health actief is, zijn er duidelijke en zichtbare veranderingen. Ambulances zijn vaker op tijd, medicijnen worden nu geleverd in het binnenland en dankzij dit is er snelle acute zorg in de binnenlanden. Riders for Health voorziet in preventief onderhoud. Daarom nemen jullie nu mee. We zijn hier bij het trainingscentrum van Riders for Health. Hier krijgen de rijders theoretische en praktische lessen over hoe zij moeten omgaan met de 4x4 auto's die ze hier hebben en de motoren die gebruikt worden om mensen te vervoeren voor medische zorg. Kom mee, dan gaan we een training volgen.
Good morning. This is the training center for Riders for Health and I'm the lead trainer today, what they call flowers. Vehicle maintenance and safety checks, flowers. Flowers means these are daily checks that you do in the morning before starting the engine. You start from fuel. Do you have enough fuel for the journey? The next thing is fluid. That means brake fluid, clutch fluid, and power steering fluid. So now we go to lights. Are all the lights working? It tells you. Are they all working?
What is the most important thing you need to do and to keep in mind as a driver?
You should be mindful of engine oil and water. Cools the engine. Otherwise, metal to metal without oil, it gets hot.
We hebben net theorieles gehad en nu gaan we naar de motor kijken.
Good morning. We are coming to do the practical. We've done the theory up there. Now the first thing is fuel.
Check if there is enough fuel.
Check fuel, yes. Yes, it's on half tank. Check.
I see, yes.
Tank. It's qualified to go to work for the day. After fuel, fluid. This is the fluid. We have brake fluid. In this ambulance, brake fluid and the clutch fluid is in one reservoir.
Yeah.
So now we check now maximum and minimum. It's on maximum. Likewise, the power steering fluid. We check power steering fluid also. Power steering fluid. We have maximum also and minimum. The steering must be straight,
Exactly.
like this. So you measure it. And after that, fuel lights. Are they all working? Therefore maximum, minimum, dim, then therefore signal.
It looks fine.
Wow, parking light, okay. Brake light, brake, wow.
Yes.
Okay. Number plate light is working. All the lights are working.
Welkom in de werkplaats van Riders for Health. Hier worden elke 5000 kilometer de voertuigen gecheckt en gemaintenance. Nice to meet you.
Welcome.
You're the head technician of the motors. Nice to meet you. I'm Colin.
I'm Salif.
You gonna tell us what you do and what you train the riders before they need to go on the roads, right?
Good. You're highly welcome. That's the motorcycle Yamaha AG 100 two-stroke engine. Yeah, normally we train the riders, our field staff, on how to do on motorcycle. That's called plans. These 5 letters, you need to follow them. Starting from petrol, that's P. Check your petrol daily before you go for a journey. Check your oil, the two-stroke one, up one. Yeah? If at all it's sufficient, then it's done. Here is the alarming area.
Minimal.
When it is reached here,
Yeah.
you have to make sure you have to top it, because this oil is the backbone of this engine. If you are around here, we refill your tank, you go. Whenever this tank goes down, you come here, we refill it. But if you are far from here, we give you 2 liters,
Yeah.
so that you will never run out of this one. Yeah?
Yeah, and then it can drive because every 5,000 kilometers it needs to go back to the mechanic.
That's it.
And the 2 liters is exactly for the 5,000.
Good.
Nice to meet you.
Yeah,
I'm
nice
Colin.
I'm Sheriff.
Nice to meet you.
Nice to meet you too.
Hi.
Yes, Amadou.
You are a mechanic here, the head mechanic if I'm correct.
Yeah. I am the head technician of Riders for Health Canifing Workshop, and what we do here is so we service vehicles to make sure they do not break down.
Yeah, exactly.
Yeah.
And that's really important because if ambulance cannot go on the road and someone need it, that's not good, of course.
Yes, so this is why we have preventive maintenance, whereby there is a stipulated kilometer or 5,000 of which we service our vehicles, you understand? And in order to avoid delay, what we do is we try to assess the vehicle kilometer to know the next service model, what the vehicle will need, then we order it before the vehicle comes.
So to prevent a vehicle by standing still, you have like the 5,000 kilometer rule, and then a vehicle is coming in, you do the maintenance together so that every vehicle is being on time back on the road.
Sure.
Yes.
Yeah.
Good job that Riders for Health is doing here.
Yeah, definitely.
That was everything.
Oh, okay.
Thank you very much.
Thank
man.
you too.
Thank you.
Thank you. Thank you. You are welcome, huh?
Always. Thank you very much.
Yeah,
Also.
all right.
Thank you.
Okay.
Nice to meet you. You're a driver, right?
Yeah, I'm a driver for
So
Riders for Health.
you're gonna explain what's gonna happen if an ambulance needs mechanical assistance or a checkup.
I'm a driver for Riders for Health. Normally when we are having a lot of errands, there's a kilometer that you need to cover. When you reach that kilometer, you need to visit your office for service maintenance.
That's 5,000, right?
5,000 kilometers. From there, when you just come, report to the point, you just park to the gate, you just try to knock, and the security will have to attend to you. They will just ask what is the purpose of you being here so that you can get in, and they will have to let you be. On your way in, you just go straight to the car park that is for the car wash. Normally, that's what we do. When you just wash your car, from there, you just take your kilometers, go back to your chief driver, that is your head. After that, you bring that kilometer, you go to your chief driver. He is the one who has to record that to come for the service, to make sure that it be in order. From that, he has to consult, record it, and send it to the chief mechanic.
So he's gonna send what's need to be done. Is that correct? Yeah.
He's going to say what is need to be done.
Maybe if
Then-
something also is not working anymore.
Yeah. You need to repair or fix it, it does. That's how from there, take your car, go to the chief mechanic that you are sent to him by your boss, that is the chief driver,
And then from there, you hand over the key,
to the mechanic,
and then there they drive it onto the.
ladder, the strategy ladder to jack it up and to see whether there are some parts missing or not moving in as expected. They have to work on those. Then from the complaint you got, they have to check many more other around to see whether there's a lot of voltage from other end to make it more service.
And they do their whole check
Yeah.
because they're mechanics. They know everything, of
Then
course.
yeah, so it's
So
expected.
they will do the full checkup and see
checkup.
if it's
Yeah.
working fine still, or something needs to be changed,
Change,
or if it's correct.
It's
Then
correct, leave it normal.
exactly.
Yeah.
And that takes some time, I guess.
Yeah, it depends on how the service
Yeah.
you reported the matter.
Yes. And then after that, you come back.
Yeah, you
they hand
come
over
back.
the keys.
You come back and sit for the driver room, waiting room.
Yeah.
When the mechanics are done, everything, they have to bring down the car for you and bring you back the key from the chief driver. And you go, and the chief driver have to call you
Yeah.
to come for your car that is done. Where you go back, and when you are on your way going back again, going out of the compound, the security will still need to check whether there are some voltage or there are something that's missing or whatever.
Yeah.
Let them just have to confirm whether you are leaving. Are you done for service? Yes, you are done.
And then you can go back to work.
We'll go
again.
back to work normal.
How happy are you with the riders?
Oh,
Working for them and the job they're
very
doing.
grateful. Working for Riders, it brings me so courageous in terms of my working system. Because I'll be working from any other facilities, different companies, but I get more experience with Riders for Health, whereby I expected work to up to expectation there. So I don't think with Riders I can rely on my services delivery. So Riders are well motivation, they are motivating, they are well standard.
And you do a lot back to the community, of course, because they need their riders. You're doing a good job, man. Thank you very much.
Thank you very much.
Thank you. Naast al het werk op de vloer moeten er ook beslissingen genomen worden. Daarom gaan we in het gesprek met het management.
I'm Ken Diko. I'm the administrative manager responsible for the human resource. That's
The people who are making Riders for Health, right?
yeah, the people that make things happen.
Yeah.
And we have boxes of applications waiting. And at times we would be looking at specific personnel to recruit.
Yes.
Then it is done differently. But otherwise, when we have vacancies, we just go back to the application boxes,
Yeah.
extract some, invite them for interviews, for screening, and then have them on.
What makes the riders for you unique and special in the Gambia?
For me, first it would be the working environment. Because here people see each other as family. There's a lot of social interaction. And another thing is the work that Riders for Health does. Because we support the Ministry of Health to deliver healthcare service to the people, especially those in the hard to reach areas, by properly managing the transports that are used to reach those people to deliver the services. For Riders for Health, everybody working for Riders for Health is driven by mainly two things. One is our intervention in supporting healthcare to the need. The other one is the social interaction at Riders for Health.
Yeah.
Everybody laughs and teases with each other, and the working environment becomes sweeter.
Yes, that's really good to hear. Thanks very much. What exactly are you doing here for the?
Well, thanks for that question. Basically, this is the M&E office, the Monitoring and Evaluation Unit. I'm the M&E officer, and she's my able assistant. We work together on this office, and one of our work is to making sure that riders' programs and activities are implemented the way we want it, and if there are any corrective measures that we need to work on, we actually put this to management for us to solve, working towards that.
Why do you think the riders is that important for the Gambia?
Well, riders is very, very important for Gambia, especially in the health sector, because health sectors without reliable transportation is no health system.
Do you have anything else to say?
Yes, just to thank you guys as our great partners from Holland. We really appreciate the support that you're rendering to Riders for Health, the Gambia, and this is actually impacting lives. Thank you so much for that.
Thank you for saying that.
Thank you.
also. De inzet van Riders for Health is ontzettend belangrijk in de binnenlanden. We gaan daar nu heen, blijven daar overnachten en morgen nemen jullie mee naar de medische post in Njau. Dit is dus een car waar ze eerder mee naar een medisch centrum gingen. En dan zat er een paard of een ezel voor. Nou, je snapt wel natuurlijk dat een ambulance een stuk sneller en beter is voor de personen. You're the officer in charge.
Yeah.
Nice to meet you.
Thank you. Nice to meet you.
So,
yeah, you are
you're
highly
gonna
welcome to Njau.
Thank you very much.
Yes, thank you very much.
You're gonna show us your room, the working place.
This is our delivery room.
Here's where all the work.
Where we normally deliver our patients. Yes, this is delivery bed. So this is the gadgets we have. This is the delivery set, we call it.
Yes.
And this is suction machine. In case you deliver a child and the child is suffocated, then use the suction machine to suck the child.
Yeah.
So that he can initiate the breathings.
Yeah, exactly.
Yeah.
To help it, so if it stops.
Yeah.
How happy are you with the Riders for Health?
Yeah, I'm very happy with Riders for Health because when I was a junior nurse, by then there was no Riders for Health. Things were difficult for Minister of Health, especially transportation of patients to tertiary institute. It's always a difficult time. It makes things easy. Transportation of patients is easier. For the coming of Riders for Health, really it has boosted the Minister of Health transportation from one level to another level.
Nice to see the work you're doing here.
Yeah, thank you very
Thanks
much.
very much.
Thank you very much.
Hello.
Okay. Yeah,
Hi,
hello.
my name is Colin.
Yeah, my name is Hassan.
Hassan.
Hassan Sise,
Nice.
ambulance driver of Riders for Help.
Nice to meet you. You're
Nice
doing a
to
good
meet you.
job.
Yeah, you're welcome.
Yeah, so you're the driver here.
Yeah, I'm a driver of Riders for Health. So as for us, we do healthcare delivery. So since Riders came to Gambia, you see that healthcare is going perfectly.
Yeah, before they were doing it with like a horse and a car, right?
Yeah,
Yeah.
by then was horse carts and cars. Since Riders for Health comes into service, everything is going perfectly.
Ah, that's really good to hear.
Yeah.
You get like a call from a patient and he needs help.
Yeah.
And you get that information where you need to drive.
Yeah, exactly. Every community is having our number.
Yeah.
If there is any emergency, they will call the facility.
Yes.
So we will rush for help.
What challenges do you encounter on the road?
Yeah, the challenge is sometimes maybe the road, these people are local people. They might hear the ambulance alarm, they will not leave the road. But you Riders for Help train their drivers very well.
To go around
To
people
go around
safely.
Yeah, how to drive perfectly. We are well trained.
And what do you see? Does it really help the community a lot? Your
Yeah.
work?
Yeah, it helps a lot. It helps a lot.
Yeah.
Because we are always ready for service delivery. Phones are always on.
24/7?
24/7. Your phone will never be off.
Yeah. You're doing a good job.
Yeah, thank you.
Thank you. Thank you very much.
Yeah, thank you.
My name is Colin.
Mine is Dembasi, the district chief of Upper Salum.
I had some question about the help of the Riders for Health. How do you experience it?
Well, very well. Riders have made that impact in the health sector. They have helped a lot. There was a time when we used these horse carts, donkey carts, because of lack of vehicles. So we are grateful and we are thankful and praying for anybody who is contributing toward Riders for Health.
Good to hear. Thank you very much.
It's a
Chief.
pleasure.
Thank you very much.
It's fine.
Achter elk voertuig en elke chauffeur zit een heel team die dit allemaal mogelijk maakt. Dat is Riders for Health.